So hello guys, today let's go to my new website. It is healthupdatetime.com, and you can see that in that website there are many categories such as health, relationship, blog, and beside of these categories we can also include some general knowledge related to kind of nature and sciences. So without any delay, let's jump to our topic today. So today we're going to focus about the lesson which is about constipation. That in that I'm going to talk about the symptom, diagnosis, and management of that constipation. So here is the table of content. We have introduction, epidemiology, pathophysiology of constipation, and signs of manifestation and investigation, and the last but not least is management. Now goes to introduction. As we already know that constipation is a kind of common disease that mostly occurs in older patients, and the definition of the constipation is a common complaint that we have met every day in hospital for older adults. And the term constipation, we can define it by two important points. The first part, the patient has a trouble in defecation, that we call it straining, and the stool become hard, and the patient have sensation of incomplete evacuation. That's it means that the patient after they uh, evacuate some feces, they still have some sort of incomplete of evacuation. And the second part, the patient may have some frequency of stool is decreased, like less than 3 times per week. And for these two categories, we can say that the patient may have constipation. If the symptom may last for about 3 months, then we can assume that the patient has constipation. And for epidemiology, like I have mentioned above, the constipation mostly occurs in the older adults, but also younger children also can have it. And there are some risk factors related to constipation, such as female genders, depression, physical inactivity, medical use, and others. For pathophysiology, there's a lot of etiology related to constipation, but in here I mentioned about three main types of causes of constipation. The first one is primary colorectal dysfunction. That disorder of this problem is coming from the colon and rectum themselves. The first one is slow transit constipation. In this part, I'm going to talk about the movement of the colon, that it becomes slower and slower. It can be caused by the muscle, smooth muscle, that mostly it has some sort of disease like myopathy or innervation problems, which uh, becomes obstacle for the movement of the colon in the intestinal tract. And the second one is dysfunction infection. The patient might find trouble to excrete the stool from the anus due to the some sort of malfunction of the nerve at the anus, like some sort of traumatic that caused the injury to the nerve at the anus. And the next part is irritable bowel syndrome. Irritable bowel syndrome, the patient might have some sort of symptom like abdominal pain or constipation with altered bowel habits, that most of the time the stool of the patient sometimes hard or sometimes soft or wet. And the second cause of the constipation is secondary causes. For this part, it may be caused by organic, such as colorectal cancers, extraintestinal mass, or ischemia. Metabolic disorder can be the main causes of constipation, like hypothyroidism, diabetes mellitus, hyperglycemia, pregnancy, or neurologic disorder like Parkinson's disease, spinal cord injury, multiple sclerosis, or myogenic disorders. Can be myogenic dystrophy, amyloidosis, and medication like opioid antihypertensive agent, typically antidepressant, and anti-epileptic drug. And for chronic idiopathic constipation, it is very common affected for the cause, like the patient may complain about difficulty passing of stool or incomplete defecation. There may be due to the irritable bowel syndrome. So let's move to the clinical finding or sign or manifestation. So the constipation can be classified by difficulty expel of the stool, and it can be associated with infrequent stool and less frequency or defecation. Prolonged fecal impaction in the colon or anus or rectum can induce stercoda, ulceration, bleeding, and anemia. So if the patient have fecal blood test positive, it means that they have the blood in the stool, and they also have severe constipation and red loose and change in stool calibers. It means that the change of the size of the stool can be small or bigger. In adults, we should consider, or we should think about the colorectal cancers or colon cancers. So we might have to screen with the colonoscopy in the patient for older than 50 or 45 years old, and they have constipation and also have anemia. So moreover, we also have to change the medication, because we already know that the medications, some sort of the main causes of constipation, like opiate, and in some cases constipation may be resolved from the psychological problem. So we should ask the patient to describe their feeling about the stresses in their daily life in order to differentiate these diagnoses. So for investigation, so we might have to investigate some of blood values like thyroid, metabolic panel, and complete blood count. For endoscopy, we should screen for colon cancers, like we use colonoscopy because it can give the value information related to colons with the clear information in order to exclude the solitary rectal cell syndrome, inflammation, malignancy, or should be performed patient that we suspect that they might have a secondary cause of constipation with leucine and cancers. So for the management, the primary management, the first intention for manage the constipation is lifestyle and food balance. So we already know that the fiber food might be useful for increase the stool bulk and promote the movement of passage of stool. So we encourage the patient to take it daily and drink a lot of water, because the water can also soften the stool, the bulky stool. So daily fiber intake like 20 to 25 grams per day is recommended. And beside of the lifestyle changes, we also can use the stimulant laxative, because some older patients, we cannot prevent the constipation like eating fiber foods. So we ultimately use some sort of treatment to soften the stool. The stool softener like glycerin and bisacodyl have little efficacy. So opioid antagonists may have important role for patients taking narcotic drug and constipation. So for bulk forming laxative, we have psyllium husk, methyl cellulose, calcium polycarboxyl. With those drugs, it can absorb waters and increasing fecal mass. It can increase the frequency and softening the stool. For osmotic laxative, we have lactulose, sorbitol. So we use this drug for the patient that don't get the response from bulk laxative drug. For the third drug, it stimulates laxative. We call it the stool softeners like glycerin and bisacodyl that we can use in older patient. For the fourth drug is opioid antagonist. For the patient may have suffered from taking a lot of opioids, so we can use naloxone or methylnitrazone that may have important role for treatment the constipation that caused by opioid. And the last but not least drug is serotonin or 5-HT receptor antagonist like prucalopride. It can control the movement of gastrointestinal motility. So the video that talking about the constipation have finished. So I hope you guys learned something about this video, and don't forget to subscribe to our channel and visit our new website healthupdatetime.com. Thank you for spending your precious time.